I'm Ron Baker, Director of the Canadian Small Church Ministry Centre, sponsored by Small Church Connections. And this is us, Canadian Small Churches in Action podcast. As many of you know, the landscape of Canada is changing, and the way that we look at things is changing, accelerated by the last few years, but certainly one that is different as we look at how churches, and particularly small churches, deal with life. Our guest today speaks to one particular, well, we may venture into other areas, but one particular issue and one particular change, a troubling shift, particularly in modern medicine. And so I'm going to invite her just to introduce herself and just give a little bit of her background. She's got a number of things, both medically that she's done and also ministry areas that she's involved with. So I'll just let her know. She'll just talk. Let her talk. Sure.
Hello, everyone. I'm Dr. Margaret Cottle. I live in Vancouver, BC, and I work as a palliative care physician. Basically, now I've worked in many areas of palliative care, but now I only do home care, where I visit patients in their homes and help to support their families and support our visiting nurses. I've been involved in palliative care since 1988 and trained in early 1989 and have limited my practice to palliative care since that time. It's been a really important time for me. I have found it very rewarding caring for people at the end of life and helping them to see the opportunities and to reframe hope in their life, and also to do a good job at addressing the symptoms that they have. And it's so rewarding when someone has had a lot of pain or breathlessness or nausea or any of those things, to be able to get those things under control so that they can go on with their lives and really enjoy the last part of their life, which can be very, very rich. And I think that's one of the things that has given me, has brought a sense of tragedy into my life with where our culture is going right now, because I've seen that richness, that gold refined by fire, as I call it, that patients and families have been able to experience at the end of life when they get good palliative care and they have whole person medicine and their total pain is addressed. And to just say, oh, well, you know, you feel like you want to die, fine, we'll call the MAID team and we'll make sure that you're dead. It's just so sad that all that is lost in the midst of that. So I think that's why Ron has invited me to speak here today. My husband and my daughter are both ophthalmologists, and we have really noticed a change in medicine. And right off the top, I think I would like to encourage your listeners to be sure that you speak to your members of parliament, to the people in the health authority, to the people in your provincial legislatures, because there's a real push to try to get Christians out of medicine, or at least to try to, at some way, make them so that they don't show their Christianity in any way, which is completely impossible as they practice medicine. So if we want to have Christian doctors going forward, we really need your support. We're a little bit like Nehemiah on the wall right now, where we feel like the wall has been breached and we're blowing the trumpet and saying, come and join us, support us, help us here. And as part of that, my husband and I have been sponsoring the student chapter for the Christian Medical and Dental Association of Canada. And for about 30 years, we've had the students in our home providing a meal every week and different discussions and guest speakers and all kinds of other types of support. But it's been another evidence in my life of how the Lord is a debtor to no one. And all the things that we have poured into the students' lives have come back pressed down and overflowing in our lives as well. So that's a little bit about us. We have a black lab and she has her own hospital ID and she visits does home visits with me and
Oh, great.
spends some days in Rob's office. And the patients at his office wait to get into the room that has Cara in her kennel so that they can have a little visit with her. So, and we also, so our daughter, who's the ophthalmologist, and her husband, John, have 3 little girls. And our son, Alan, is a pilot with Alaska Airlines. And he and his wife, Natalie, live in Southern California, and they have a daughter and a son. So we have 5 grandchildren, and
Oh,
that's
right.
the best club ever.
Well, I mean, I'm part of that club where I have kids, and my currently I have 6 kids, and so it's great fun, and grandkids and all that sort of stuff. Yeah, it sort of brings personality to life. You see people, you watch them, and so, like, as we are mentioning and talking about today, palliative care um, becomes a part of that enjoyment, and could be part of that enjoyment for many people instead of a quick exit, I guess I would call it. And so your experience in dealing with MAID, particularly as I think of small church pastors and leaders, we tend to be very much related to and very much relational in the way we approach ministry and that type of thing. But I'm just wondering if you're seeing, as you talked about, the shifts in modern medicine, how are pastors dealing with this at this point? What are you seeing? What are you hearing?
This is an excellent point. I had an opportunity. I'm not Catholic, but I had an opportunity to be the speaker for the Catholic Women's League national meeting, and I was speaking about dignity conserving care and how we can do so much for people among us. Dr. Harvey Chachanoff from Winnipeg is a world leader in dignity conserving care, and so I was bringing that about how we can help each other at the end of life and in difficult circumstances with faith, hope, and love. And one of the questions that came in afterward is, what do I do if one of my friends in my parish says I'm having, and I've actually stopped calling it MAID unless I have to. I'm calling it medical termination, because that's really what it is. The founder of palliative care in Canada, Dr. Balfour Mount, said that, I've been doing medical aid in dying for decades and I've never killed anybody. So it's part of the obscuring of the language that we have seen in so many ways. And so I used to call it euthanasia, but that got confusing too, because euthanasia actually just means a good death.
Right.
So, how are we going to do this? So the Dutch actually call it medical termination. So I think it's actually a good way to talk about it with people who are not going to be overly offended by the fact that we're not using the term MAID. So there is a place to be all things to all people. So I don't need to stomp on somebody's toes to talk about this. But when I speak to Christians, I really want to talk about, have them understand what we're really talking about. So this woman said, what do I do when a fellow parishioner asks me to be present at her termination? How do I do that? And I said, well, this is a really good example of how we need to get upstream of this, that it needs to be spoken of in your parish. It needs to be spoken of in your churches, that this is not something that's acceptable to the Lord, so that you're not being asked to go to this, at the time, which should never get to that. And, it's going to, I understand that, but it's already there. And, there's a church in Winnipeg, for heaven's sakes, that had the woman brought in her hospital bed or whatever into their sanctuary. They had a little service. They had the doctor perform the termination there, and then they all went to the fellowship hall and had a reception afterward. So, and this is reported as something wonderful in our media. So it's not surprising that these things are coming up, but I think we need to get back to what are we really talking about? And that pastors are like all the rest of us in Canada, we're kind of polite people.
We
And we
are.
don't want to step on anybody's toes. And that's not necessarily wrong. But this has been framed in the sole virtue, so to speak, around this. It's been framed with this idea of autonomy.
Yeah.
And as Canadians, we have this idea, well, I don't want to get in anybody's way. And if this is their right and this is what they want to do, then who am I to say no? Well, we do this all the time as Canadians. In Vancouver, you can't smoke a cigarette outdoors on a public beach because of how it might affect other people. And yet we're saying, oh, well, don't get in the way of one citizen taking the life of another citizen. Really? You know, this has way more serious side effects than somebody smoking a cigarette outdoors on a public beach. I'm not allowed to have a nuclear reactor in my backyard. I'm not allowed to keep
That's
a
too
goat
bad.
in my backyard. You know, all of these things, pesticides on lawns and speed limits and you name it, it's there. We have an understanding that our autonomy is limited by how we care for one another. And through a series of conversations that I had, an addition with Dr. Margaret Somerville, I had come to this understanding about that our tradition of Hippocratic medicine, which one part of the oath says that I will not give deadly medicine to anyone, even if asked, that is like an old growth forest. So in our physical environment, this old growth forest, we understand that you can cut it down and yes, you may get a few cedar shingles for a few roofs, but you're not going to get the old growth forest back. It's going to take millennia for that to come back. And so these prohibitions against taking the life of another citizen, those are like our old growth forest. And so Margaret Somerville rephrased it this way. She said, we are just as responsible for the metaphysical environment that we pass along to our children and our grandchildren as we are for the physical environment that we pass along. And I think that's something that we need to think about. And as pastors and leaders, we aren't afraid to say, look, we need to be good stewards of our environment. So we need to have that same enthusiasm for being good stewards of our metaphysical environment as well. One of the things that might help with this is I have Dr. John Patrick, and if any of your folks have not heard of him, I suggest you have a look at his website. It's johnpatrick.ca. The .com is a professional gambler, so go to .ca. And he's Dr. Patrick is board certified he's a PhD, MD, and he's board certified in 4 specialties. And he's originally British, but lives in the Ottawa area, and is one of the founders of Augustine College, if some of your listeners have heard of that institution. But he has many resources on his website and things to talk about. And one of the things that he does when he's talking about these controversial issues is he says, what do you have to believe in order to fill in the blank? So here's my little very starkly stated, what do you have to believe in order to think that medical termination is a societal good? Okay. So what do you have to believe? First, you have to believe that there are some lives that are not worth living. Because if you didn't believe that, then you would be preventing it, right? If you thought all lives were worth living, then you prevent it. So technically what we're doing is we're aiding the suicide, because that's really what it is, a person's choice to die. The people who are supportive of medical termination say, oh, it's not a suicide. But I don't know what else to call it when you're choosing to die. But what you're saying is that we prevent we actually actively prevent some people from making that decision, and we actively promote other people making that decision. And I went and spoke to my member of parliament, and I said, well, I think it's really sad that we in Canada have come to the place where we're saying that there are some lives that are not worth living. And she was, oh, no, that's not what I'm believing. And I said, well, you can think that if you wish, but when the government creates legislation around it, they pay money to send people in to make the termination happen. They have regulations, they regulate the professions that are involved in it. You have made a decision that some lives are not worth living. And even if it's only the people who are saying it, you've still said that for those people, there are some lives that are not worth living. And it's kind of interesting that in Quebec, right after the court case, that the Minister of Health in Quebec, who supports medical termination, who's at that time the minister who supported medical termination, it must have really made him kind of cringe that he had to send out this memo. But he had to send out a memo to all the emergency room physicians to say, you know, if somebody comes in with a suicide attempt, you do need to resuscitate them. You know, it's not just a choice they've made. And so it must have kind of, you know, twisted his socks to have to do that when he actually supported medical termination, to say that, well, yes, please do resuscitate this person because you haven't got explicit consent to take the life. So that's the first thing you have to believe, is that there are some lives that are not worth living. Mm-hmm. The second thing you have to believe is that it's okay for one member of the human family to take the life of another member of the human family in a context outside of self-defense. And, you know, you could talk about that on several different levels about what self-defense involves. But this is actually what the federal government did when they brought in this legislation, was they changed the criminal code to say that it wasn't murder for one citizen to take the life of another in this context. Mm-hmm. So, you know, where does that end? What's the justification for it? So you have to believe that. And the third thing you have to believe, and this is very stark, I understand that, but I really want to bring it home, is that in some cases, killing is better than caring. So those are the three things stated very starkly. I understand that, and I wouldn't go into you know, a nuanced discussion with leading with these things. But I think pastors need to understand that, and church leaders need to understand that's what we're talking about. And so how do we get upstream of that? How do we do that? Yeah. And it's an interesting question. There's a very kind of quirky theologian by the name of Stanley Hauerwas.
Oh yeah, he's quite interesting. Yes,
a very interesting man. And he wrote an essay a long time ago now, and the title of it was something like "How to Keep Kids Out of the Backseat of the Car." So he was talking about, you know, sexual integrity and all of these types of things. And he made a really interesting point in this little article he wrote. He said, for those of us who understand what's at stake, and I'm paraphrasing what he said, so it's not a direct quotation, but this is the point he was making, that for those of us who understand what's at stake in these types of decisions, we need to make certain that we make sexual integrity a greater adventure than sexual conquest. And I think that there's a nugget of truth for us in that with this issue as well. That we need to make it so that it's a greater adventure. It's that quest that we get from Narnia and Lord of the Rings and all of these other and all through the New Testament, this idea of being on a quest, of being ambassadors for our Lord, being ambassadors in a foreign culture now, that we need to help our congregants and our friends understand that it can be a greater adventure to really be there with someone than it is to just say, oh, well, you know, if that's what you want, then that's fine. I'll just back away and we'll make sure that you get what you want. How lonely is that? You know, and there's so much I could speak of about all the things that are lost when that's the decision that's taken. But that's the place where I think pastors have an opportunity to come to their congregations and say, you know, we've got the opportunity to lift Christ up. And he promises us that whenever he is lifted up, he's going to draw all people to himself. So we can do this by coming alongside one another, bearing one another's burdens. I try not to use the term burden when I'm speaking about this because patients already feel like they're burdened, but we can be there in challenging situations. We can be there when people are hurting. When someone feels like my life is not dignified anymore, we can come alongside them and say, you know, well, if you're not feeling dignified, then that's our issue. We don't think that babies are undignified because they need help with the activities of daily living. And they're members of our human family. If we get to the stage where we need help with those daily functions, bodily functions, it's not undignified to have help when we need it. And we as Christians need to model that. We need to stand up before our world and say, if I need help with this, then I'm willing to accept it. Dr. Edwin Hui from Regent College, who passed away not too long ago, he liked to say that there's a Christian duty to be cared for every much as there's a Christian duty to care. And that we all understand we have this duty to care, but if nobody allows us to do the caring, it's kind of a moot point.
Exactly.
So our society is enriched when we care for one another. We understand this. Every one of us has seen this in our own lives about how the caring people that come alongside us and care for us, or when we've had an opportunity to care for someone else, we are enriched. As I said before, the Lord is no person's debtor. And that what we get out of that is not what I call the Cracker Jack, and this is maybe dating the two of us, the Cracker Jack plastic gold trinket that you get from autonomy and saying, oh yeah, if that's what you want, fine, we'll sugarcoat it. It's that gold refined by fire that you get by being there and being there in a hard place. And you know, our culture gets this at some level. They understand how important it is for teammates on an Olympic team when they're doing this heavy duty training. They understand it when they see things that happened in the wars where, you know, a band of brothers, or even back as far as Shakespeare with the beautiful Prince Hal's beautiful soliloquy where he talks about St. Crispin's Day, you know, and how we you know, that we band of brothers, which is where that came from. That you know, that we understand that there is something very special about being there with another human being in a time of great need. And there's very few animals that have that opportunity. It's something that sets us apart. I think there are a few animals that have a little bit of an understanding of it, but for the most part, it's certainly not as deep as ours is, and they certainly don't have the language to express that support and care and concern for one another. So, you know,
I think that, you know, a large part of what you're talking about is something that I think small churches inherently sense, but maybe don't put out well, is that community and relationship and caring for one another is vitality for people to the end of their life. And we miss much when we are not with people and we are not for people. And I think when people struggle for their rights and that type of thing, I think you said that their rights are an admission that our love has failed.
Exactly.
We haven't done a good job Let's put it that way.
Yeah.
That-
Well, I think too, if nothing else has happened in the last couple of years with the pandemic, we have understood the value of community.
Mhm.
Because when it was gone, we were, we were at sea when, and it was so hard for our families taking care of patients at home. You had an 85-year-old woman trying to take care of an 88-year-old man with a broken pelvis, and nobody else is allowed in there to help
Yeah.
out when there might be a large extended family along who could come alongside. All those, the fabric of our society was so frayed by the lack of community that we can see how important it is to build those things in.
Mhm.
And I think the thing you were referring to was one of my colleagues at one point had made that statement that rights are an admission that love has failed.
Yeah.
And if we all took it very seriously, the first part of Philippians 2, where it says, that we need to not look out for our own interests, but the interests of others. If everybody did that, we wouldn't need rights. But Winston Churchill once said democracy was the worst form of government, except for all the others.
Except for,
and and I think that that's kind of what it is with rights. If we live in a fallen world, so we don't have it where everybody is looking out for the interests of others.
Mhm.
So we do need those rights, especially for people who are in vulnerable populations or who have other vulnerabilities or other issues, are prone to discrimination and some of those things. I'm not opposed to rights, but I think as Christians, we need to be very careful about celebrating rights and realizing that it means if we have to have these rights, it means that our society isn't honoring God 100%. And that are there ways that we can work toward a society that looks more like that Philippians 2 society would have us look. That are we pouring ourselves out, that kenosis passage, that emptying? Are we pouring ourselves out to care for other people and to show what their worth is, to provide that dignity, conserving care to them? What are we doing to help them to reframe hope? What are we doing to show them that they are still important to us and that their actual willingness to allow us to care for them is a gift to us. Mm-hmm. It's a gift to us, and it's a gift to our children and a gift to our grandchildren to see that what we do as human beings is we care for each other. Yeah. And I've stopped speaking in the public forum about sanctity of life, because not that I don't believe in it, but as soon as you say those words, I don't know whether you've seen those roller shutters that are on certain businesses, but as soon as you say sanctity of life, the shutters just come down. And it's like, I don't hear you, I don't see you, I don't care about you. So what I've started doing is talking about care to every member of the human family. And that has a little bit, it's a little more of a touch point with that kind of an idea about care and respect for every member of the human family. Yeah. One of my colleagues, Dr. Quentin Jenis, frames it this way. He says, it's what we do when we do these things is we provide hospitality to the most vulnerable among us, to those who are most vulnerable among us. And so I think some idea of providing hospitality, which is where the word hospital came from, and hospice and all those things, providing hospitality for every member of the human family, welcoming every member. We see that in Jesus. Jesus did that throughout his ministry. He touched every child. He touched lepers. He healed people who were living with disabilities and illnesses. He cared about people with mental illness. He cared about women. All of these different issues were front and center in his ministry. And so we can be most like him when we do those things. And I think one of the things that James talks about in his book is that true religion is caring for widows and orphans.
Yeah.
And, really in our society, the life issues at both ends of life are really our widows and orphans.
Mm-hmm.
That there are so many of the children who are still in the womb are kind of orphans today. And their mothers, a lot of them are like widows. And at the other end of life as well, we've got people who are living without support, because that's really what that was about, was who around you is unsupported, who needs your care. And it doesn't take much looking to find that. And I think the wonderful thing about a small church is that they know who these people are.
They
You
do.
can have a big church and people can come and go at the back of the church and you never really know what their needs are. But if you're in a small town, in a small church, or even in a small church in a big town, you know what those needs are. And if you don't, you should. But, as much as people disclose, that. And there needs to be some training and some help in figuring out how to do some of these things. I've given quite a few talks over Zoom about dignity conserving care. I never charge anything for talking about any type of palliative care or medical termination things or any of this. And so if there's a group of pastors or who would like to have an evening where I would give a talk about that, like I did for the Catholic Women's League, I'd be very happy to do that, because there are some really practical things that you can do. And just, the number of people who have opted for medical termination simply because they were lonely, or simply because they couldn't get enough support from the government to come in and help them with meals or whatever. It's just heartbreaking. And we're well placed in a small church to do those kinds of things. So I think that's something that could be thought about. And you know what, Pastor, I'm speaking to you. You don't have to do it yourself. Get yourself a little task force. Get some of those retired folks in your church, or some of the ladies in your church, to have a little group, just like the casseroles that came when you had a new baby. There are all sorts of ways of doing this. And even if all it is helping to support the caregivers. When my mom was in her last days, one of her friends came once a day and just said to me, "Shoo, get out of the house. I'll stay here with her for an hour." And it was amazing. Yes, it was amazing how just that 1 hour made such a difference in how I was able to kind of go back and be involved and do that. And this was before I had any palliative care training, and it made such a difference. And providing meals. I thought, oh, well, I don't really need to have meals provided, and I'm not near the end yet. And one of my friends said, "Margaret, you've provided so many meals for people, we could bring you meals for a year, and you wouldn't be, we wouldn't owe you anything. You wouldn't owe us anything." And I was absolutely shocked at how helpful it was to have the meal, because I didn't have to think about it. I didn't have to shop for it, and it was good when people brought the things in disposable containers. At the end of my mom's life, I had, I don't know how many little casserole dishes I had that with the blue corn flour on them, but that there were some things that were there. But one interesting story about that is my dad did not become a Christian until many years after my mom passed away. And one of the people who brought a meal at that time, I had moved away from where my mom was living. My mom and dad were living about 3 or 4 months before my mom died. And I was able to come back and care for her without having a job, a home, church commitments, other things. It was actually perfect because I was able to focus and bring my two little kids and bring the grandkids and focus on caring for her. But one of the church that I attended then put out this call for meals, and one of the people that brought a meal was a new bride who had just moved to the town, and I actually wasn't there when she delivered the meal. And she said, my dad said, well, who is this person that brought this meal? And I said, well, I actually have never met her. And he was completely disarmed by that. Well, why would she bring you a meal? And I said, she brought me a meal because she's part of the family of God, and she knew that we had a need. And for a man such as my dad, where the practical outworking of it and the idea of, hypocrisy within the church was a big stumbling block for him. That was a huge step in his faith journey, that this young woman who had never met me, had never met my mother, would do something this personal for us was really important. And, you never know who in your community is watching you.
Yeah.
And you have an opportunity as a small church to really model what it means to be the people of God and what it means to honor every life. You have this opportunity in supporting people who are living with disabilities who are living among you. You have this opportunity to celebrate every child. Our culture is so anti-child, really. And you have an opportunity to support people who are living with serious illnesses or at the end of their life by coming alongside them and helping them to, as I've said before, reframe hope. Well, maybe they can't be there for a wedding or a graduation or whatever, but what can they do? My absolute favorite example of somebody who did this was a 7-year-old girl whose brother was in Canuck Place, which is our children's hospice here in Vancouver. And she went to the dress-up box where the kids could play, and she dressed herself up as a bride. And she went to her brother's room and she said, I wanted him to see me as a bride because I knew he wouldn't be. My goodness. When I heard that story the first time, I'm just weeping at her wisdom. I wanted him to see me as a bride, she said. So those are the ways that we lift each other up. Those are the ways that we care for one another. And those are the things that are a witness to our culture. Dr. Sheila Cassidy, who's a palliative care physician, I think she's retired now. As far as I know, she's still alive, but she wrote, she's a Catholic woman. She wrote an amazing book called Sharing the Darkness. And my Buddhist friend loved it. It's very ecumenical. And she uses some images, some biblical images. And one of the images that she uses is the image of Mary, Martha's sister, pouring out her precious spikenard, her whole dowry over Jesus' feet, and how it was anointing him for his death, and how that was an extravagance of caring that Judas and some of the others said, oh, it's a waste of money, it could have been given to the poor. But that aroma of this sacrifice that she made went up as a witness before everyone around. And Dr. Cassidy says that when we care for people who are not going to get better, they're not going to make a contribution to society, so to speak. Although allowing themselves to be cared for, in my opinion, is making a contribution. But just as our society would define it, that they've only got 2 weeks to live. When we expend our precious resources on caring for those people, then that is just like Mary pouring out that precious spikenard, and the aroma of that goes up before our culture, saying this person is valuable and this person is made in the image of God. and we have the privilege of caring for them.
Mm.
Another image that she has in her book is called the Stabat Mater, and that just means the mother stands. And there are some masses that are done about this, and some beautiful music that has been written. But it's about Mary standing at the foot of the cross. And what Dr. Cassidy talks about is how when Mary stood there, from a human perspective, she was completely powerless. She couldn't really speak to him. She couldn't moisten his lips. She couldn't sing hymns to him or read scriptures to him or fluff his pillows up or bring in a grandchild. She couldn't do anything to help him other than bear witness. And that sometimes, but no one would ever say that Mary did nothing by standing at the foot of the cross. So sometimes, as Dr. Cassidy says, the most powerful thing and the hardest thing that we can do is simply to bear witness to what's happening. And it's hard to be there. I know that. I know it's hard to be there. But if the Lord has asked us to do something, he always provides the resources for us to do that. And just thinking about what it cost Mary to stand there at the foot of the cross, and how we can follow in her footsteps when we come alongside people who are really hurting and really suffering. And it doesn't just have to be end of life. It can be people who have gone through all sorts of other tragedies, and no community is a stranger to tragedy and to stuff that doesn't make sense to us. I think that's the other thing about this is you don't have to figure it out. I took a systematic theology from Dr. Packer for credit back when I had little kids, and I wasn't quite sure what I was getting into, but it was really a wonderful class. And one of the things that he said in that class that I thought was just brilliant. Well, he said a lot of brilliant things, but one of the things was that God seems to delight in giving practical answers to philosophical questions. So he says, you're concerned about the heathen? Great, so am I. Go tell them about me. He doesn't say, if you've had this much light then, or that much, or, whatever, how you get into heaven. And if you're concerned that, that people are suffering at the end of life, or that they've had this tragedy in their life, so am I. I died on the cross for these people. I know what it feels like to have a family member who is suffering. Go alongside, help out, be the person who's the good Samaritan where Jesus says, go and do likewise. Why the person is suffering, all of that, you don't have to figure that out, and for heaven's sakes, don't try to say that it's because of a lack of faith that they have, or it's something bad that they've done, or they brought it on themselves. Even if that might partially be true, that has no place in dealing with the suffering of that individual at that point. Unless you're the pastor and the person is trying to confess something to you, then you don't blow that off and say, oh, never mind about that. You do have to deal with things that are like that. But coming in to a setting and trying to explain it is borders on being abusive in my opinion. And the person who's just had a cancer diagnosis probably doesn't need to have Romans 8 quoted to them at that point. What they really need is just your presence, that you come alongside them. We call people Job's comforters as something that's a derisive term, but those men came and sat there for a week and said nothing, and just sat with him and sat in his misery with him. And I don't know very many Western Christians who would be able to do that, myself included, I have to say. But let's understand that all we have to do is just come and be there, and keep your eyes open. We have friends who lost a child, and they said it was hard when people came and tried to explain things and tried to say, oh, well, he's gone to heaven, or, all these things, the platitudes, that was hard. The best thing was when people just came and were with them and didn't try to do anything. The second best was when they came and they kind of messed it up. But the worst was when they didn't come at all and they just left them alone. So being isolated and being silent was worse than saying the wrong thing. And, it's not that hard to figure out if something has landed poorly. Just watch the person's face. And if you get something, then say, gosh, I'm kind of new to this. I haven't been taught how to do this. Help me learn, teach me how I could have said that better, or what would have helped you more. I'm sorry. Those kinds of things make a big difference. And just offering practical help. I asked my friend whose dad died when he was only 50, and there's all sorts of things. I said, what's the most important thing that somebody could have done for your family? And she said, the dishes.
There you
go. It just, there are lots of things that are there, and so many creative ways. And we have such a creative God. He will inspire you in ways that can do this. And one thing that it would be really helpful would be to have someone from the church go and interview the family and say, what are the things that would help you? So that when, and then go recruit people from the church to do those things. And here's my caveat with that. When you ask people to do something, make sure that it's very specific and that it's time limited. So instead of saying, can you take a meal to the Jones family, then you say, can you take a meal on Tuesdays for the month of November? And then if they say, well, Tuesdays were fine for me, I can do it for December as well. Or no, I can't do December, but I can come back in January. Whatever it is, if it's time limited and very specific, then that can be helpful. And there are some really good apps now for meals. Like there's one called Meal Train and some others where people can even put in their allergies and their food intolerances and things like that. But it's good to have someone who the family doesn't have to do the asking. If the little girl needs to go to a piano lesson, or the little boy needs to go to soccer practice, and you can provide that kind of care, then sign up for it, or doing the vacuuming, or just coming and sitting, or coming and reading.
Well,
those kinds of things.
I'm going to have to cut us off here because we're about done as far as time goes. But this has been very, very helpful. Much wisdom and forethought has gone into this. I can tell you've worked this through. So we just want to say very much thank you for what you've provided us with today. Thank you very, very much.
Well, you're quite welcome. And as I said, if anybody wants to have more in-depth training about some of these things, then let's get a group together and do that. It's better if we can make it so that more people can attend. But, Jesus went to Samaria to talk to one woman. So who am I to count numbers?
Right. All right. Well, thank you very much.
You're quite welcome. Thank you for having me.